welcome back to our next episode of the Hormone Café. Today, I want to talk about environmental and lifestyle endocrine disruptors and what is important to know when trying to conceive, trying to have excellent longevity, and have good energy every single day. So I'm going to give a little asterisk. I get a little nervous about talking about this topic because sometimes people can get into such a deep hole that it creates a lot of fear. And they're afraid to go places. They're afraid to touch things. They're afraid to drink things. So I really do not want this episode to be a cause of fear, to introduce anxiety. I want it to be a refreshing overview of little tiny changes that we can make on a day-to-day basis. So we have great energy, we're able to conceive, we're not disrupting our hormones, we don't get cancer. So I want you to take all things related to environmental and endocrine disruptors with a grain of salt, meaning that I don't want you to go so far down a rabbit hole that you're full of fear and anxiety. I want us to have a healthy, fresh perspective where we're doing our very best every single day, but not over analyzing in a way that is trapping and can cause more anxiety. So today we want to talk about what endocrine disruptors even are. What does that even mean? How do those affect fertility and hormone balance? Some of the most common exposures that we'll see in everyday life. And then we'll go over some realistic steps to reduce exposure without becoming overwhelmed. So, of course, it's really hard when we're trying to get pregnant. We don't have energy. We feel like something's off. We're trying to balance our hormones. Often, it seems like there's so much stuff that we have to be doing, and that can be very, very overwhelming. So I just want to empower you with the knowledge and give you some really basic and easy takeaways so that it doesn't feel overwhelming. Okay. So we are exposed to thousands of chemicals daily. And so it's going to be literally impossible to get rid of all chemical exposures. But we'll talk about the ones that are truly evidence-backed, truly scientific things that we can use to support our health so we're not getting overwhelmed. So it's about awareness and making a few high-impact changes. So what is an endocrine disruptor? Endocrine disruptor is literally a chemical that interferes with hormone signaling. So, for example, they are little elements that can mimic hormones such as estrogen. They can block our hormone receptors. We have hormone receptors in many places in our body, in our breast tissue, for example, in our uterus. Endocrine disruptors can alter our hormone production. So hormones are made in different places. They're made in our adrenal glands. They're made in our gut. They're made in our ovaries. So different materials can alter the healthy production of those hormones. And then it can also affect the metabolism of our hormones, whether that's in our gut, kidneys, or liver. So hormones operate at very, very small concentrations. So even small chemical exposures can influence signaling. Endocrine disruptors can be associated with altered menstrual cycles, ovulatory dysfunction, lower egg quality, thyroid disruption. So we want to make sure we're not putting anything into our body that can affect those hormone signals at a microscopic level. So why does this matter for our hormones and for our fertility? So a lot of endocrine disruptors act as what we call xenoestrogens. That means that they're chemicals that mimic estrogen in the body. So if we have excess estrogen signaling, then our body thinks that we have a lot of estrogen on board. So that affects our body's ability to ovulate. It affects our uterus lining, which is our endometrium health. It can affect implantation, and then it affects that ratio of our healthy estrogen to progesterone. So we want to make sure that we're not intaking any or exposed to any substances that are acting like estrogens in our body. So let's talk about the most common exposures, the major endocrine disruptors that we need to know. So number one, BPA and bisphenols. This is when we think about our plastics and why we want our plastics to be BPA free. So BPA is going to be found in things like plastic containers, canned food linings, receipts, water bottles. The reason that we care is because BPA does have some estrogen mimic activity. It can alter our ovarian dysfunction and our egg maturation. And that can affect our body's ability, of course, to ovulate properly. So number two is called phthalates. That's spelled PHTHALATES. Phthalates. This is going to be in our fragrances, our perfumes, our scented candles, cleaning products, and some plastics. So again, these are also associated with hormone disruption and altered estrogen signaling. So when we look at something that's fragranced, we just want to make sure it doesn't have chemicals called phthalates. And then number 3 is parabens. So parabens can be found in cosmetics, lotions, skincare, makeup. Those are also weak estrogen mimics. So they do disrupt our menstrual cycle and alter our body's ability to make hormones properly, especially with high exposure. And then there's something called PFAS, which is sometimes called forever chemicals, mean things that just stick around forever. So these are most commonly found in things like nonstick cookware, waterproof fabrics, food packaging, some stain-resistant furniture, and certain drinking waters. And that can really specifically affect our ovarian hormones and our thyroid function. And then the last thing is pesticides. So this can be on certain types of produce. If we're exposed to pesticides from being in the lawn, chemicals, or other agricultural environments, pesticides are linked to endocrine disruption and altered ovarian function. So that's why it's important just to do things like choose organic foods for certain fruits and vegetables and wash our produce well. So those are the 5 big chemicals that we want to focus on. So our BPA and our bisphenols, our phthalates, our parabens, our PFAS, and our pesticides, because those are the most scientific, evidence-based things that we want to stay away from. So we do not need to eliminate every exposure. Our bodies are amazing. They know how to detox. So if we're exposed to a pesticide, if we're exposed to some BPA, our body actually knows how to detox and process that. That's why it shows up in our urine, right? Because it's literally getting detoxed out of our body. However, we just don't want to override our body. So it's not that we have to have none. We just want to limit the exposure. So an important thing here is our 80-20 rule. So 80% of the time we want to be good. 20% of the time we can have small exposures. For example, you might be out and about and there might be a plastic water bottle. It's okay to have a plastic water bottle every once in a while. But when we're at home, we're going to want to be drinking from non-plastic sources, right? Our silicone, our stainless steel, our glass, for example. So it's not that you have to eliminate these things 100% of the time, because if you are exposed, your body will detox it. It's just that we don't want to be exposed so often that we're completely overriding our detox pathways, okay? So we do not need to eliminate every single exposure. We'll just focus on some daily habits to make the highest impact changes. So food and kitchen things we'll talk about. One is that you want to avoid heating your food in plastic. So heat increases chemical leaching. So just always make sure you heat food in glass, stainless steel, or ceramic. So no plastic in the microwave, okay? And then you just want to use glass or stainless steel water bottles. Again, we can have a plastic water bottle every once in a while, but if something you're going to be drinking all day long, just make sure you're doing glass or stainless steel. And then just avoid having canned foods on a daily basis. Also, a lot of cans can contain BPA-based linings. So we want to look for BPA-free cans or glass jars or things that are frozen instead of canned. Another thing that we want to look for is ultra-processed food packaging. So highly packaged foods increase our exposure to plasticizers and food contact chemicals. So it's not that we can never have a packaged food. It's just that if we want to lean more into whole foods. We want to be eating foods that are themselves and less foods that are in a package, okay? So let's talk about our personal care products, because that's where we're going to see a lot of our parabens and phthalates. So just look at the label, just make sure it says fragrance-free, paraben-free, phthalate-free, okay? And make sure the ingredient list is very simple. So fragrance-free, paraben-free, phthalate-free. If it has a fragrance, just make sure you know what the fragrance is. So if it says rose, that's something that you know what it is. If it says mint, that's something that you know what it is. So if it does have a fragrance, just make sure you know what the source is. So just check your perfumes, any scented lotions, any scented candles, any air fresheners. You always want to be paraben and phthalate free. Same thing with our home cleaning and products. Simpler is better. So we want to be doing just sometimes even the basics like water and vinegar. Water and baking soda is all we need. And then make sure we're always doing a fragrance free cleaner if possible. Same thing with our cookware. Instead of using nonstick pans, we want to be doing stainless steel, cast iron, or ceramic. And then when we talk about water filtration, I would just make sure that you're drinking filtered water or that the water that's coming into your house has a high quality filter. So if you're not sure, you can definitely install or have a plumber install a filter literally to filter all the water in your house, because that can reduce your exposure from showers and washing your hands and especially your drinking water. So not that you have to have that all the time, but if you have a high quality filter in your house, that will make sure that you're getting the cleanest possible water when you're drinking and the water that's touching your body. So I want to give you the top 5 changes that I want you to think about. So stop eating food in plastic, fragrance-free personal care products, glass or stainless steel water bottles, and then wash your produce thoroughly. So wash any fruits and vegetables literally with soap and water. And then you want to, any high pesticide foods, those are the ones you want to prioritize organic. You often see these as the dirty dozen. The dirty dozen, you want to make sure that you buy those in organic. And then you want to reduce as many packaged foods as possible. So if you have to rip it open in order to eat it, that's something that you just want to eat rarely, not something that you want to incorporate into your diet on a daily basis, because then we can just overall reduce our general endocrine disruptor exposure. So it's impossible to avoid every chemical exposure in modern life. The goal is not perfection. It's reducing the biggest sources and then also supporting our body's natural detox systems. Because as long as we're keeping our liver clean, keeping our gut clean, keeping our kidneys clean, even if we have a little bit of exposure, our bodies can detox this. It's similar to, for example, bacteria and viruses, right? Not every time we're exposed to a bacteria or virus, we're going to get sick because we have an immune system. Our immune system can fight those things. But if our immune system is worn down, then our body loses the ability. Or if we have a humongous bacterial or exposed to a huge bacterial or viral load and our immune system is worn down, that's when we get sick. So endocrine disruptors are similar. It's not that we can never be exposed to them. It's just that we want to keep our detox pathways healthy. So keep our liver and our gut healthy, and then just have as minimal exposure as possible so we're not getting sick and overwhelming our bodies. So you definitely just want to make sure as many things as possible are just literally whole foods. They are what they are. And then when we think about our detox pathways, we want to make sure that we're getting enough fiber intake. So we want to be doing at least 25 to 30 grams of fiber a day to support our digestion, getting enough water and hydration to also support our detox pathways, moving our bodies to support our lymphatic drainage and our circulation, and then, of course, supporting our liver through nutrition. And those little small changes can definitely meaningfully reduce your total chemical burden. Remember the 80-20 rule. Focus on a few big changes rather than trying to control every single exposure so you can keep your body healthy on a daily basis and it doesn't get overwhelming. If you need help teasing out any of those specifics, how can you help your detox pathways? What are some other things that we can be doing to optimize your hormones? Please don't hesitate to come check us out. We are here for you. And I can't wait to see you on our next episode of the Hormone Café.